Hi, I'm Michael Riley, a double board-certified facial plastic and reconstructive surgeon and board member of the Foundation for Facial Recovery. Today I'd like to share some of the highlights about the diagnosis and initial treatment of sudden facial palsy, and I'd like to help explain the difference between Bell's palsy and Ramsay-Hunt syndrome, which are two related but distinct conditions that cause facial nerve paralysis.
What is Bell's palsy? What is Ramsay-Hunt syndrome?
Bell's palsy is a catch-all name used to refer to sudden inflammation of the facial nerve of undetermined cause. It accounts for the majority of all facial palsy cases. Most cases of sudden facial palsy occur due to a reactivation of the viruses responsible for either cold sores, called herpes simplex 1 virus, or chickenpox, called the varicella zoster virus. Due to a combination of waning immunity and other factors like stress and other causes of immune suppression, the virus gets reactivated and is able to spread out of the nerve roots where it's been hiding and down the nerves, causing significant inflammation along the way. A much smaller percentage of cases appear to be due to infection with Borrelia burgdorferi, the bacteria responsible for Lyme disease. It's important to note that not all varicella zoster-related facial nerve paralysis includes a rash. That condition is called zoster synoherpetae, or zoster without the rash. Because it can't be clinically proven to be Ramsay-Hunt syndrome, it's often included in the category of Bell's palsy of unknown cause.
How does facial paralysis occur?
When something agitates the facial nerve like a trauma or an infection, the nerve swells and gets compressed. Sudden facial palsy can manifest with a variable degree of facial nerve weakness, along with other symptoms that can include a change in taste sensation, dizziness, ear pain, ringing in the ear, and hearing loss.
Who gets sudden facial palsy?
Sudden facial palsy is most prevalent in people between the ages of 20 and 40. The lifetime risk of experiencing an episode of sudden facial palsy is about 1 in 70.
What are the chances of getting complete recovery from sudden facial palsy?
Fortunately, the majority of people with Bell's palsy will recover completely without any intervention. For those with incomplete paralysis, total recovery is almost always obtainable. If the facial movement begins to return within 4 weeks when there is complete paralysis, then chances of recovery approach 90%. If there are no signs of recovery by 12 weeks, however, the condition is unfortunately almost certain to become chronic.
What is the recommended treatment for acute peripheral facial palsy?
Large studies on this condition have demonstrated that more than 25% of patients with incomplete recovery have long-lasting effects of chronic facial deformity and dysfunction. Irreversible nerve damage has been shown to occur within 3 weeks of the onset of the condition, and it is my belief that until we develop a method to determine which patients are at highest risk of incomplete recovery, a more aggressive medication regimen is indicated for all patients with sudden palsy to reduce the risks of a poor outcome in some of those patients.
What specific medications do you recommend?
In the absence of contraindications, I recommend a high-dose steroid taper for 3 weeks total, starting at 60 milligrams of prednisone daily for 7 days, and then tapering by 10 milligrams every 3 days over another 15 days total.
The next thing is to get people on an antiviral medication. In the big studies, they've really shown a negligible improvement in facial paralysis outcomes from people who are on antiviral treatment. But the caveat to that is that the antiviral treatments that have been used in those studies are a 1-week course of antivirals. And what we know is that when people have a viral reactivation from either herpes simplex or herpes zoster, the two main viruses that cause facial paralysis, the likelihood is that their immune system is going to take at least 6 weeks to mount its optimal response to those. And so until there's a study proving that 6 weeks of antivirals don't help, my tendency is to put people on antivirals until they start to show improvement, and often even longer than that until they're fully recovered.
Any other advice for the early treatment of sudden facial palsy?
As always, when deciding to undergo a treatment, you should incorporate a thoughtful analysis of the risks and benefits. Talk to your provider about their comfort level with treating the condition, including their knowledge about what to do for those with incomplete recovery. If your doctor is not a true expert in managing the condition, it is reasonable to ask for a prescription for high-dose steroid taper, an antiviral regimen, and then to seek an immediate follow-up consultation with a true facial nerve expert. Please visit RileyFPS.com or the Foundation's website at foundationforfacialrecovery.org.